Good morning, everyone. Thank you so much for joining us to unveil and really dive into our Advocates for Ohio's Future and Ohio Poverty Law Center's joint report, A Billion Here, A Billion There. Where have all of Ohio's COVID relief dollars gone? We will give folks just about one more minute to head in from that waiting room, and then we will get started. We're happy you're here. We will go ahead and take care of some housekeeping before we get started. Please, if you ever have a question during the presentation, please feel free to enter that question in the chat, or as always, please feel free to answer or insert it into the Q&A, and we will get to those maybe after each speaker, and then there will certainly be time at the end to address questions as well. So we'll get started in just a moment here. All right, folks, we will kick things off. Once again, folks, my name is Kelsey Berkfeld. I'm the Director of Advocates for Ohio's Future, and I am very excited to be here with our partners at the Ohio Poverty Law Center to announce and the release and dive a little bit deeper into our online COVID relief fund tracking tool and accompanying report, again, aptly titled A Billion Here, A Billion There, both intended to answer the very complex question of where have all of Ohio's COVID relief dollars gone? Over the past 2.5 years, billions and billions of federal relief dollars have funneled into Ohio and local communities, all intended to respond to the COVID-19 pandemic by keeping people safe, healthy, and really maintain vital services and ensure a strong and equitable recovery from the COVID-19 pandemic and accompanying economic crisis. And as you can see, where we are focused, our research and our data collection has been over the past 2.5 years. We've seen over $13.3 billion with a B dollars come into Ohio, to the state and to local entities as discretionary funds to, again, address some of those issues and, again, make sure people are safe and healthy and have access to those services throughout the pandemic. Just a quick timeline. We looked back in March of 2020, about 2.5 years ago, at the CARES Act, as well as a year later in March of 2021, when Congress passed the American Rescue Plan Act, and we really dove into the coronavirus state and local fiscal recovery funds, again, at the state and local level. So we're excited to tell you more in just a moment, but wanted to share that really the inspiration behind this resource and the accompanying report was a realization that even as self-proclaimed really data and public policy nerds, it was really difficult for us to sift through and really track the spending and the allocations of all of these billions of dollars rather, of federal relief dollars through the past 2.5 years. Again, they span multiple funding streams, multiple different sources, and have gone through different federal agencies as well. And we, again, wanted to make sure that we could have an understanding of where those dollars were going, as well as how are they making an impact. So we wanted to make sure that we could track those dollars, how much money was allocated for what purpose, and has it been spent to date? Again, some of those dollars were allocated 2.5 years ago. Some of them are still being used and accessed today. How was the spending authorized, specifically on the local level? How was it sent out? And then on the state level, maybe what avenue or vehicle that it was passed and allocated. And then at this point, how much money is left to be allocated at the state and local level. We know that lots of those dollars have to be encumbered or kind of assigned by the end of 2024 and then spent by 2026. So it's still, in the grand scheme of things, a little bit early in the process, but a lot of those dollars have gone out, but there's still a significant portion remaining. We hope by compiling this data, we've created a really useful one-stop shop and tool for our partner organizations, friends in the media, as well as individuals and other stakeholders to be able to really easily follow the money and recognize how the state and local entities have prioritized these funds. And really, we do hope that this is such a great tool or resource for, again, general public, or maybe folks who don't advocate or take part in the public policy process very often, We think, this first step to participating in your community, we know that the very best resource and source for people to know where those needs are and really where some of those gaps in services or where improvements can be made come best from folks in the community. And we wanted to make sure that folks could understand where those dollars were sent and maybe where those gaps again can be filled and how they can take part in that process. So really want to encourage advocacy, especially as we break down into those local allocations. So without further ado, I'm going to hand it off to my partner at AOF, Sarah Hudasek, to talk about how those CARES Act dollars were allocated and what good they did. So Sarah, when you're ready, please take it away.
Great, thanks so much, Kelsey. So as Kelsey shared on the previous slide, the CARES Act created the Coronavirus Relief Fund, and that distributed $150 billion to state and local governments across the country. And there were very few limitations on the use of these dollars. So they had to be used to address costs that were incurred due to the pandemic. They couldn't supplant existing funding. And they had to be used for costs beginning March 1st, 2020 through December 31st, 2021. So that was the last day that CARES Act dollars could be spent. Ohio's total CRF allocation was $4.5 billion, and $1.9 billion of that went out to local governments. So about $775 million was distributed to Ohio's largest local governments directly from the U.S. Department of Treasury. And then the General Assembly later allocated $1.2 billion to those remaining local governments across the state. That left $2.6 billion for Ohio's state CRF share. And Ohio used that money to invest in a number of sectors to promote the health, safety, and economic stability of Ohioans throughout the pandemic. So breaking that down, altogether, Ohio spent more than $1 billion on Ohio COVID response. And that included COVID testing, PPE and ventilators, ensuring safety in public places for things like social distancing, deploying emergency management personnel to local hospitals and clinics, ensuring safety in Ohio's prisons, deploying the Ohio National Guard to Ohio's food banks and food pantries, and also providing funding that Ohio's state agencies needed to respond to the unique challenges of the pandemic. So that's $1 billion out of that $2.6 billion state share. With the remaining, Ohio spent about $509 million, that's almost 20%, of those state CRF funds on provider relief. And so that included payments to skilled nursing facilities, long-term care providers, rural and critical access hospitals, Ohio veterans homes, and behavioral health providers. Another $441 million, or 17% of Ohio's state CRF funds, went to K-12 public schools, private schools, institutions of higher education, and school broadband connectivity grants. 13.4%, or $347 million, went to business relief to bars and restaurants, the lodging industry, entertainment venues, small businesses, and new businesses. And then after you take all of that out, the remaining funds went to rent, mortgage, and utility assistance, local health departments in every county and in large metro areas, mental health, childcare, nonprofit support for veteran service organizations, domestic violence shelters, grants to nonprofits, food bank support, and more. And detailed information about all of that I just went over is available on the new ARPA Tracker webpage that we're excited to dive into with you today. So unlike American Rescue Plan funds, Ohio's CARES Act funding has already been allocated and expended. So why does this matter? How can you use this in your advocacy now? So this is a screenshot from our ARPA Tracker website where you can access a detailed list of every expenditure authorized with CRF funding. So I grew up in Seneca County. If you were an advocate in Seneca County, for example, here's some of what you would find in this data. Now, this isn't a comprehensive list of all allocations to Seneca County entities from CRF funds, but it can give you an idea of the range of data available on our site and the wide array of the types of allocations that were authorized with CRF funds. So for example, local school districts and universities received funding through CRF dollars for pandemic response, mental health, and broadband access. There were allocations out to public libraries and to county fairs to ensure social distancing. And the county jail received funding to prevent and respond to COVID, among a number of other allocations going out to Seneca County in the full spreadsheet on our site. And then I also wanted to highlight that every county also received health department funding and an allocation for that county's general use to respond to the pandemic. So those two lines on the bottom with more than $3 million each, those are two separate allocations that make up that total 1.9 billion that was sent out to local governments. So this was Seneca County's piece of that. So this CRF data on expenditures, it's really intended to show what's already gone out to communities, and it can add additional context and background to any current advocacy you're working on American Rescue Plan dollars. And so with that, I'll turn it over to Carson Tucker, who's going to dive into the ARPA data.
Thanks, Sarah. So taking a step back to look at how the web page came to be, you have to understand data a little bit. So I'm going to give you the world's fastest data 101 course. When you're gathering data, you have to understand what it is you're looking at. In this project, for example, I started with the American Rescue Plan Act itself, looking at the final rule and guidance from the Department of Treasury. I also made sure I could understand government expenditures and allocations generally at the state and local level. I did a lot of background reading and research before I even tried to find the data. Then I had to find good, reliable sources to get the data from, and we'll discuss examples of reliable sources in the next slide. So, we could, considering timeliness and reliability as well, like we could pull together a flawless data set that tracks every cent and presents that to you in 2026 or 2027 and be 100% correct on everything. But what we wanted to do was provide information to you in real time and know the inevitability that things are dynamic and constantly changing. So you just have to kind of consider that when you're building a data set. So next slide. So here we have a reliable list of non-exhaustive list of sources. And you can tell, a lot of these different places where we found the data. But I want to hone in just briefly on the local news outlets and creating RSS feeds. This is something new that I learned. So I just wanted to share it with folks. RSS feeds, really simple syndication is what RSS stands for. And you basically have a feeder that you can have an attachment on Chrome that you put in the Columbus Dispatch, for example, and local news sources from around the state, and it gathers them all in one place for you. And then you use that to search across them. And so I check that every morning and I search for, COVID relief, ARPA, COVID-19, pandemic, things like that, so that to sort of cut down on the time that I'm spending and simplify the sources that I'm looking at and gathering the data. And of course, you have the, many other sources on there, the city council meeting minutes and agendas, county commissioner meeting minutes and agendas. Those are really important for the local data. So next slide. If you'd like to follow along as we dig into some of the data, take a moment to go to www.ohioarpatracker.org. So next slide. Once you're on the web page, if you scroll down a little bit to the State Fiscal Recovery Fund, we'll look at the table under that. And let's look at the detail at the pediatric behavioral health care facilities. You see the 84 million. And let's click on the link for that. So on the next slide, you see when you click the link, you can see the level of detail, each individual hospital or facility that it went to, the amount, how much of the allocation from which House bill or other source has been spent, and where you can find it in the House bill via the line item reference. You can also see when we last updated the data. From this date, you see August 5th, and this one won't be updated because you see it's on 100% spent. So it's been allocated to various facilities across the state. Next slide. So going back to the web page, if you're following along, you scroll down to Local Fiscal Recovery Fund. And if you scroll down, you'll find Columbus and Franklin County. And you can see at a glance here with the tiles where we've listed what they've funded. They've funded youth and childcare, but you can also see with the percentage remaining, the circles, that there's a significant room for advocacy because there's a high dollar amount remaining. So when you click expanded details, let's look at Columbus first. You can see Columbus's expenses. And there are significant investments in youth programming and childcare incentives. You see that. You also see $5 million to nonprofits. So you can kind of analyze and go back to that initial idea that I pointed you to of understanding the data and the data set as far as whether or not these expenditures or allocations were in the spirit of the law by using the final rule and the guidance and things like that. Going forward, if you're following along, go back to the web page and click expanded details from Franklin County. And here you see significant investments in Columbus Urban League toward the bottom, over $1 million there. And then on the next slide, you'll also see toward the bottom, 23 million to child care payments. So now that we've seen the data, the question is, how can it be used? And you can use the data with free visualization software like Tableau or even Google Sheets to create charts for the story that you want to tell. That's kind of what data is about, is telling a story. And you want to be sure that other folks are understanding what the framework that you've built, that you understand. So you use this data, you use specific numbers to ask questions or make requests via email, phone calls, in-person meetings, or hearings. And so you can say, for example, well, there's X dollars left in Columbus or Franklin County. We haven't spent any money on X fund or initiative that is clearly listed in the American Rescue Plan Act. Why haven't we done this? And that's where you're doing this in the in-person meeting. You can do this on social media. We've seen folks do this already on social media with our data and with our web page, and just tagging officials and tagging city council and things like that. So it's all about putting all those pieces together. And you can also use certain terms like pilot program, or if it is something that's going to be like a one-time fund, indicating that it won't be base building for the budget and things like that. Those are important things to know as well, because what we're seeing is state representatives not wanting to add additional funds or dollars to what they consider the base. And so that is basically it. With that, I'll turn it over to Susan.
Thank you, Carson. Good morning. Thanks for joining our webinar this morning. I'm Susan Jagers with the Ohio Poverty Law Center, and I just want to thank Carson and Sarah for the amount of time they've spent collecting and gathering the data and putting it together. as a tool that we can all use for our ongoing advocacy efforts. So along with the release of the ARPA Tracker website, we also released a report, as Kelsey highlighted in the introduction, $1 billion here, $1 billion there. And the report, I'm going to say, put some color on the information collected, and we'll share just a few highlights from that report. As you know, Sarah mentioned when she went over how the coronavirus relief funds from the CARES Act were spent. You heard how those were allocated, and decision makers did have some discretion over those funds, and but the uses were somewhat limited in time frame and purpose, and the time frame was shorter than what we're seeing with the American Rescue Plan. Most of the CARES Act dollars went directly to responding to COVID or helping entities impacted by closures or Ohioans staying at home. When the American Rescue Plan dollars first came to the state in May 2021, we had vaccines and we thought we were turning the corner. But here we are in 2022, and while we're in a different place with COVID, many families and communities are still dealing with the health and economic impacts of the pandemic. So the American Rescue Plan was a very big response to the pandemic, and it has multiple funding streams. And we hope to be able to share information about other funding streams with you in the coming months. But our report and what I'll be talking about today focuses on the state and local fiscal recovery funds. And there were certain parameters around the spending, but these were largely discretionary dollars for our state lawmakers and local city councils and county commissioners. So Ohio received $5.4 billion in ARPA fiscal recovery funds. To date, Ohio has spent $3.5 billion, so almost 2/3 of its funding. The first and single biggest use of the ARPA state funds went to the Unemployment Compensation Trust Fund to repay money borrowed from the federal government to pay unemployment benefits to eligible Ohioans during the pandemic. After approving this expenditure in June 2021 in House Bill 168, Ohio transferred nearly $1.5 billion to the trust fund in September of 2021. The repayment will prevent future tax increases for Ohio employers that would have been needed to pay off the loan. So that was the reasoning behind investing what was more than 25% of the state fiscal recovery funds into the Unemployment Compensation Trust Fund. Since then, the state has allocated money through legislation or the controlling board to a number of other purposes. The controlling board, just to note, is a mechanism to approve limited appropriations without legislation or going through the legislative process. You can see on the chart on the slide some of the other expenditures outside of the Unemployment Compensation Trust Fund. The second largest allocation is going to Appalachian Community Grants. And that money is not out the door yet. So that's an opportunity to keep tabs on and check the website for how that money is being spent. So that money has not been allocated to communities yet. So certainly that's something we are watching around how those grants will be awarded to communities going forward. Other expenditures from the American Rescue Plan dollars were water and sewer grants, dollars for pediatric behavioral health care, which Carson highlighted as an example when she was going through the tracker, public safety grants. So there was a number of other expenditures. But I do want to highlight for you some of the process around how these dollars were allocated and just give you an example of some of the most recent allocations. In the week before its summer recess in June, the General Assembly allocated $1.3 billion, so almost another fourth of the funding. And they allocated that $1.3 billion in 2 bills over 2 days with no time for public input or comment. So I just want to note that a big chunk of that money, $800 million, was used to fund projects in the capital budget. And that included $100 million for the Facility Construction Commission for physical school safety and enhancement grants. So you can see that on the chart that's part of the slides. There was money for state parks and trails and facilities. There was money for the Department of Agriculture for a new animal disease laboratory. And then one thing that I really want to highlight is about 400 million was allocated as part of the incentive package to bring Intel to Ohio. And that's local water and sewer infrastructure at 100 million and a water reclamation project for $300 million. So about $400 million through the capital budget is going to that incentive package to bring Intel to Ohio. And again, all of these allocations occurred without the opportunity for public input. Often the plans and details were released as amendments were being considered or legislation. I'm going to switch and talk a little bit about the local allocations too. Our report looked at some of the local investments of ARPA dollars. We looked at 8 major metropolitan areas, and Carson highlighted Columbus and Franklin County, but you can find Toledo, Cleveland, Youngstown, Akron, Canton, Dayton, and Cincinnati as well on our website. So another $5.3 billion of recovery funds were divided among Ohio's counties, cities, and townships. Local jurisdictions were under the same rules for spending of the funds as the state. And we did, collect information in these 8 areas. We hope that Carson provided some information how you can gather some data in your local jurisdiction if it's not one of the ones that we looked at. Unlike the state, which ended its most recent fiscal year flush in cash, many of the local jurisdictions had budget deficits and used the ARPA dollars for budget stabilization or revenue replacement. So we did see that as an expenditure in most cities and counties that we looked at. Other top expenditures included investments in parks, neighborhood revitalization, small business support, and housing. Many of the investments targeted specific community needs based on the input of community members. So something else interesting that we found when we looked at the data is that unlike at the state level, many communities had a process or have an ongoing process to solicit community input, public input, and ideas on how the money can best be invested in their communities. So Sarah, next slide. I'm going to go back to talking about the state level funding again. We talked about what has been spent, but I think it's important to note what's missing as well. So we haven't seen American Rescue Plan dollars at the state level allocated to food assistance, housing assistance, broadband, reducing health disparities, support for nonprofits. And like I mentioned, there's been little opportunity for public input. And though Ohio has spent nearly 2/3 of its $5.4 billion, that leaves $1.9 billion remaining to be allocated. So what can we expect as a timeline for those dollars? So we noted that some of the allocations had gone through the controlling board, which has the ability to allocate limited dollar amounts to certain purposes. But we kind of are hearing that we shouldn't expect to see many more expenditures go through the controlling board. So that leaves the legislative process to allocate the $1.9 billion. As many of you probably know, the General Assembly is on recess until after the election. And then they'll be back for 5 to 6 weeks of session and work before the session ends at the end of the year. So depending on the election results, we could see more of the money appropriated during this lame duck period. But also to note, as we head into the new year, the new General Assembly, the 135th General Assembly, will be considering a 2-year state budget that will be introduced by the governor in February or March. The House and the Senate will consider the budget, which needs to be passed by the end of June. So I would imagine if they don't allocate the funds in lame duck, we'll see it be part of the conversations during the state budget. And of course, we have some ideas on how that money should be spent, which was a key part of our report as well. So I will turn it back over to Kelsey to provide an overview of our report's recommendations on how the state could best use the remaining ARPA dollars.
Excellent, Susan, thank you so much. And just wanted to acknowledge we do have a couple questions in our Q&A. We are going to briefly go through again our recommendations, and then we will certainly get to those questions in just a moment. But wanted to highlight again, really another of the main motivations behind why we wanted to make sure we were tracking and had an idea of where these dollars were going, is so that we could identify our partners and other stakeholders and individuals could identify where the gaps are and where those needs are greatest, and where those dollars would, we believe, again, would be best spent to have the greatest impact and help the greatest number of people, again, continue to recover from the pandemic. And also, again, make sure that everyone has an equitable recovery from the pandemic. We know that the challenges of the past 2.5 years have certainly highlighted some disparities that existed long before the pandemic. And again, a historic investment like this has a potential to do great good for not only now, but really in the future for all Ohioans to have a little bit of a brighter future moving on from these challenging times. So really what I wanted to share for our final part of this presentation before we get into those questions was our recommendations of where the remaining state fiscal recovery funds. So this is Ohio's discretionary funds. There's just under $2 billion left, where those dollars we think should go to make the greatest impact and serve the greatest needs across the state. And really the first proposal, and this is a proposal agreed upon by all partners at Advocates for Ohio's Future, is to invest in the COVID cliff. So we know when the coronavirus pandemic really took off, a public health emergency was declared on the federal level. There are a number of flexibilities across public programs, enhanced benefits, and other waivers in place at the moment that are tied to that public health emergency. That public health emergency has been in place since January of 2020, and it is renewed by the federal government, Department of Health and Human Services, each 90 days. So we had our first, so again, every 90 days since January 2020, the federal government has renewed that termination. Our current termination for our public health emergency lasts through mid-October. We should be getting news soon to see if that will be, or a 60-day notification as promised by the Biden administration to see if that 90-day emergency declaration will be continued. Fingers crossed, I would say that it might be, but who knows? Again, we know a lot of different factors go into that decision at the federal level. However, when that federal public health emergency does end, there will be lots of changes and lots of I would say maybe some losses, some significant reductions in benefits for folks who have really relied on some of these supportive services for a long time, still trying to regain their footing and gain some stability from the effects of the pandemic. So a number of those investments that we would say would need support are in really basic human and supportive services. We have put together a brief proposal to respond to that COVID cliff, or really the loss of some of those enhanced supports that we see. We'll see at the end of the federal public health emergency, some of those effects will be felt very, very quickly, other effects down the road. And I really want to highlight our number one ask, our greatest need, as we could determine at this point, would be to shore up capacity at our food banks. So once that federal public health emergency does end, we will see a great reduction in SNAP benefits. We know that SNAP recipients have had a maximum allotment or kind of an enhanced benefit to support their nutrition since the pandemic and the emergency has been declared and in place. Once that does end, we will see a reduction of $120 million in food assistance across the state of Ohio per month be implemented. So that is a great loss to families across the state who, again, are dealing with not only the end of the pandemic, but inflation and rising costs for fuel, for food. I know pocketbooks across the state have been impacted, and it's been a challenge really for everyone. So we'll see a loss of those really necessary and needed vital food benefits with the end of the federal public health emergency. Our immediate ask of the state government would be $50 million immediately, so that our food bank network across the state can shore up their food supply and be ready for when that COVID cliff does hit. Again, October would be the earliest, and the next date would be mid-January. To support the Food Network in the long term, the remaining 133 million or so would be invested in the food bank's logistics and their overall system to ensure delivery and to make sure that capacity is there from here on out. Next, we also know that there will be some changes and a lot of eligibility renewals to be handled by our county departments of jobs and family services. We know that a number of counties have seen some challenges in staffing and capacity and being able to really serve folks who are in need in a timely manner. So we would like to see some investment and support for our local jobs and family services offices, those agencies, specifically those caseworkers who are going to be working those phone lines, working those eligibility cases, and make sure that folks who are eligible for these supportive services continue to receive them. In-person assisters, again, we mentioned some of those losses in food and nutrition supports, but we will also see for the first time in 2.5 years at this point, redetermination of the entire Medicaid caseload. Right now we have over 3 million folks on the Medicaid rolls in the state of Ohio, and each and every one of those folks will need to be redetermined for their eligibility. We hope that many folks who are no longer eligible have received healthcare and other health insurance coverage through their employer. However, we do expect to see a number in the unfortunate hundreds of thousands of Ohioans lose their access to healthcare and coverage through the Medicaid program. When the public health emergency does end through that redetermination process, we want to make sure that there are services there for folks to turn to both find healthcare through the private marketplace, through our navigator system. We know that process is really difficult to maneuver, lots of administration, a lot of paperwork to get through. Want to make sure those assisters are there. Want to make sure that our legal aid system is there and strong to make sure that folks who have questions, or if they maybe feel that they were terminated from public programs wrongly, that they have access to their due process rights and help along with that process, as well as making sure that there's widespread knowledge about these changes that are coming about and how folks can best prepare for, again, what we are dubbing the COVID cliff and a potential loss of a great array of public services and programs. And then, of course, we know that our direct service nonprofit support system across the state has been incredibly stressed for the past 2.5 years, really without a lot of support from the federal government, from the state government to deal with some of those increased costs, to ensure that their staffing levels can remain the same and make sure that they can continue to provide those vital services that folks will need. We know that really those local services are going to be the first line of defense when folks do find themselves at a loss of some of those protections, those benefits. We want to make sure that we shore up that entire system. Again, with our first and our highest priority at the moment being an immediate investment in the food bank network across the state. So these would be our immediate investments for a short term, again, coming to in the grand scheme of things, a pretty small price tag of $331.5 million for those immediate needs, again, to really support people's basic needs and well-being during this time. And then looking in the long term, the remaining $1.5 billion, we'll say, we would like to see used to address really long-standing problems that cause health disparities and poor health outcomes for communities across the state. So we know that there's a lot of factors that go in to a person's health and well-being, and we would like to highlight 3 different issues that we think, again, in the long term, so these are disparities that were in place and occurred long before the pandemic, but certainly have been enhanced, and really, again, with the resources that we have at hand, can really go a long way to help address these disparities moving forward. Lead poisoning prevention. Right now, there is a House bill introduced by Representatives Tom Patton as well as Representative Dontavius Geralds to support the Ohio Lead-Free Kids Coalition, ask for significant investment in ARPA dollars to prevent and address lead poisoning in Ohio. We know that Ohio does not rank very high in terms of lead safety for kids. We know that there's a lot of older infrastructure in the state. We want to make sure our kids are not being poisoned by lead, and they have the brightest chance at a bright future and not have to worry about the dangers of lead poisoning. So their ask is contained within that House bill, looking for movement within the General Assembly, or if, again, action of your controlling board is also an option. Housing stability, access to safe and affordable housing certainly impacts health outcomes and really impacts the family's ability to define stability. And we wanted to express our support for our friends at the Coalition of Homelessness and Housing in Ohio, or COHIO's ask, along with 230 other organizations for a one-time investment of just over $300 million to address supportive and affordable housing. Again, will go a long way to address infant mortality and keep our older adults housed and safe. We know housing stability can certainly rattle a family and be at the core of really how they can find stability to support themselves to recover, and investing in some of those services to ensure capacity is there will go a long way to address those health outcomes and stability. And then last but not least, we want to highlight in August of 2020, we know some of the work that was done around the Minority Health Strike Force to address the disparate impact of COVID-19 on minority populations across the state. There was a really fantastic and comprehensive report or blueprint released in August from that work that would highlight, again, immediate and long-term steps that the state could take, really actionable steps and plans to address these long-term disparate impacts of really disparities, and as well as how we can increase well-being and decrease those disparities across the state. We would like to see investment in a number of those action plans and steps, again, laid out in a fantastic report. We're really incredibly supportive of it, and would be any of those suggestions would be a fantastic and really effective use of those dollars, and really answer the intended use of the dollars that were awarded to state and local governments of ensuring that folks have a strong and equitable recovery from the pandemic. Again, that is not a comprehensive list of all the good things that these dollars can be used for and should be invested in on both the state and local level. I hope that our conversation and our presentations today and walkthroughs from Sarah and from Carson, who have really done such, I'd like to echo Susan's congratulations and praise, have done such an incredible job of making this data accessible. I know someone who does not enjoy spreadsheets, find this not too intimidating and really easy to navigate. Just want to thank them again for their partnership at the Ohio Poverty Law Center. And we are excited, again, for more people to use this tool. We hope our walkthrough today will make it easier to use the tool and find what you need easy. We also do advise you and would ask that you please check back periodically. We will be continuing to update our information, not only update the information we have currently on the webpage, but we will also be adding new funding streams, new tracking resources over the next few months. And just to give you a brief preview or a teaser for what will be coming in the coming months, we'll be tracking emergency rental assistance dollars, those ERA dollars. We'll be tracking broadband funds throughout this that are coming from the federal government. Again, these really span a number of federal funding streams. So we will be digging in and making some sense of where those dollars have gone, what have gone out, and what they're going to be used for or should be used for. We'll be tracking K through 12 and also higher education from the public and private standpoint, where those dollars have gone. Tracking childcare funds, digging into what's left, what they can be used for, and how they are being used. And then also we are excited to release specifically a state-by-state comparison. We think it's really important to see how Ohio has prioritized their funding and how they've allocated those dollars as compared to other states who have also had billions and billions of dollars to allocate and meet the needs of their citizens. So continue to please check in early and often at our webpage. We will make lots of changes and make sure it's as up to date as possible. We want to ensure that it's a really useful resource, and certainly more is to come. So we are going to dive into our questions that we've had from the audience. We want to thank you for hanging with us to this point, and we will dive in. So our first question is, anyone else doing tracking like this? Is the state doing tracking like this? Are there other states that have taken on a project like this? And I will direct this to our partners, Sarah and Carson, as our data folks talk about a little bit why we decided to put this together.
Sarah, would you like to go?
Absolutely, yes. So that's part of why we wanted to embark on this project, is because when we ourselves were trying to track for our advocacy and for our partners so that we could share that data and that knowledge, there is not a comprehensive resource like this that tracks from the allocation out to the expenditure to where it actually went, so that everyone across the state, can see what's going out to their local communities. So that's why we really wanted to do this. So to our knowledge, from what we have found, there is not this comprehensive, this detailed of a resource anywhere else in the state. And as you can see from Carson's slide that she shared earlier about where we collected this data, there is this data available piecemeal, across a lot of different sources, but there isn't a location where this is tracked this way. So that's why we're really excited to share this with you and excited to ask you to continue to check back for updates, because this is data that you really can't find anywhere else.
Well said, Sarah. I will just ask, we know that there are some national organizations who have been kind of tracking on a national scale where some of these dollars have gone. However, as we found in our research, those are maybe not as up to date as we need. And we are, again, committed to keep this page as up to date as possible, weekly, monthly basis at the most, to make sure that the best up to date information is available. And then I'm going to direct this next question to Susan. Will the state budget allow enough time for this money to be spent by the deadline, or should it be allocated before the end of this year?
So the American Rescue Plan Act timeframes kind of go out a couple of years. So the money needs to be appropriated by the end of 2024 and spent by the end of 2026. So in theory, there's enough time, for the state budget to allocate these dollars. I think what we would say is there's some immediate needs. So we would hope, like the food bank ask, would be addressed sooner. But know that some of the other proposals, we may want to have a transparent process with public input, the legislative process, to allocate the other dollars. Of course, we have recommendations for how a lot of those dollars should be spent. But if the budget is passed by June 30th, the allocations would be, start July 1st of next year, if they would be part of the budget bill. They could be outside legislation, which would make it go into effect sooner than that as well.
Great, thanks, Susan. Next question is for Carson. Did you notice any interesting trends or patterns in funding allocations, either across the state or local level? What initiatives did you notice receiving high funding across multiple counties or cities?
Yeah, I will share my screen and go to the web page for this. So when you're looking at the local fiscal recovery fund, the cities and counties that we've tracked, in the funded, we've pulled some of the biggest allocations or expenditures so far to date. And so that is, if you're not a data person, you don't like the data, you don't like the spreadsheets, you don't want to mess with Tableau or anything, it's a really easy way to just kind of scroll through and see what trends we've picked out. So for example, you'll see budget stabilization, and then you'll see budget stabilization, budget stabilization, budget stabilization. Are you noticing a trend yet? And so that's just one way that you could pick it out. The other thing that you could do is actually get into the data. And as I mentioned, put it into, transfer it from PDF back to an Excel file, put it into Google Sheets and make charts on your own, and mess around with it and see what you see. Or put it into Tableau, which is really user-friendly, and pick out the trends pretty quickly.
Great, thanks so much, Carson. Next question, I think maybe Sarah or Susan, if you want to pitch into this one. It's a two-parter. Can you talk about whether advocates should be going to the state to ask for this funding or focus on asking for funding at their local governments? And then part two is how can local advocates get their ask before the state?
I'll get us started, and everybody else can join in as well. I think I would say to the local or state level, a question, both. I think the opportunity at the state, when you see the allocations, they're for like bigger chunks of money and programs. And at the local level, some of the asks are for specific nonprofit programs. So I guess it kind of depends on if you're asking funding for a bigger policy reason, which might be a good ask for the state, or if it's more of specific program funding in a community, that might be an appropriate local ask. But I think what we wanted to highlight with the data and the website and report is that there are dollars still left to be spent, and we should all be advocating on what we think the best use of those dollars are. So state or local, there's opportunities at both places. And how can local advocates get their ask before the state? Well, they'll be out campaign. A lot of state lawmakers will be out campaigning between now and November. So look for them in your community, and you can always talk to them about how you think the dollars can best be spent. The governor has been his spokesperson, and they have said a number of times they're compiling all the asks. So I think you can do a formal written note to the governor or contact via email with ideas of where you think the money should be spent. And then, what we want to do is increase the public knowledge about these dollars. When you hear that billions and billions have been spent, it's kind of overwhelming, and you don't think you can have a voice in that, but you absolutely can. So it's just talking to your lawmakers or your local elected officials.
Great, thank you so much, Susan. And then we have one more question. Again, folks, if you do have additional questions, please feel free to enter them into the chat or into the question and answer function. But our last one is specifically tied to the lead poisoning funding request. Maybe Susan, you can take the first stab at this one. What are the anticipated funding requests for lead prevention and reducing health disparities? Are there specific specific programs that are being lifted to reduce health disparities? We know that particularly we highlighted House Bill 587 that is again introduced and we know has, I believe, had a couple hearings in this House of Representatives, but wanted to hand it off to Susan to tell you a little bit more about that bill and other efforts to reduce health disparities.
Sure. Thanks, Kelsey. I will note there's a link in our report to the Lead-Free Kids Coalition analysis or fact sheet that goes with House Bill 587. But some of the highlights from that are an investment in the Lead Poisoning Prevention Trust Fund to allow individuals, nonprofits, and landlords to access funding to remove lead paint from homes. There's lead abatement tax credit. There's money for the Department of Development. In this proposal, there's money for the Department of Development to increase workforce activities to do lead abatement work, as well as funding for the Department of Health and the Department of Medicaid to address lead poisoning in our children and help not only prevention, but also some resources for it. So there's a lot more detail on the Lead-Free Kids Coalition website around that. And on reducing health disparities, again, in our report, there's a link to the Minority Health Strike Force report. There's a number of recommendations. I think there's 34 total recommendations in that report. The governor did establish that strike force with leaders, health and community leaders to make those recommendations on how we could reduce health disparities that were exacerbated by the pandemic. So I'd point you to those recommendations. I don't think we haven't picked out, saying recommendation 4, 5, or 6, but there's a number of suggestive ways that we could begin to undo the long-standing barriers to healthcare for many communities in Ohio.
Thanks, Susan. This next question, this is our last one that we have so far. Again, feel free to keep them coming, folks. We have a few more moments together, and we will, I think this could be a joint answer. I'll take a first stab. What role does the federal government play in oversight of for how these funds are spent, tracked, reported on, et cetera, and whether they comply with the intent of the funds? So my first comment, I would say, we know that the state, the Department of the Office of Budget and Management did compile a state report on spending of the state fiscal recovery funds for that first year. So at the end of 2021, we saw their compilation of the state, their explanation of how it meant, or their allocations met the intent and the guidelines for that spending at the time. I will say we have seen through the federal guidance an expansion and greater use or allowable uses of these dollars. We have seen great, I'll say, creativity. We'll see maybe some pressing of those boundaries as to how some of these investments and allocations fit into the, again, general intent of those dollars. We know that Governor DeWine himself has stated over and over he would like these dollars to be used as for one-time projects, one-time investments. I think we would argue some of his investments so far may not meet that or that recommendation in itself, but I think that the federal government, I'm not quite sure, and I can't speak to, and I'm hoping one of my co-presenters can speak to any formal kind of tracking and or evaluation the federal government would be doing for the spending. Again, there is still a lot of time left for these dollars to be spent. So I'm not quite sure exactly what the timeline would be for the end of that examination, but we'll hand it off to Susan, Sarah, Carson, if you have anything to add.
I'll just note, I know for some of the funding streams, they do have reporting requirements to the U.S. Department of Treasury, and there are some reports available for some of the funding streams, but I don't know that there's anything in particular for the state fiscal recovery fund dollars yet, because as Kelsey mentioned, the timeline goes out to 2024 for how this should be spent. But there is, general auditing and oversight of the dollars, but I don't know of evaluation of how those, the intent of the funds is being tracked.
All right, that may be the end of our questions today. We want to thank you for hanging with us so far and appreciate your time. And of course, I hope that you find the tool useful and that the report provided helps again provide some color to those dollars and a little bit of explanation as to the decision-making process and helps guide where those dollars have gone so far. We want to remind folks that we have been recording this conversation from the very beginning. You will be notified when it's available. I know on Advocates for Ohio's Futures website, we will be sure to house our slide deck as well as link to the full recording, the report, and access to the web page is of course on both of our websites. And we want to thank you for again hanging with us and for being interested in how these federal funds have been allocated and in recognizing the potential these dollars really have for the future of Ohio, for the future of Ohio's children, families, and such, to make sure we can all move forward together. So again, thank you for being here. We will see you next time. Please be sure to check back at our website for additional information, up-to-date tracking, and we are excited for what's to come. So thanks again for your time. Have a great rest of your day.